Well, my name is Chase Bailey. I practice family medicine here at Grandview and Roy. Been with the clinic for about 6.5, nearly 7 years now. In October, I had the opportunity to participate in a humanitarian effort with a group called the Haitian Health Initiative. This is something we've wanted to do, my wife and I, for some time. She's a nurse as well, and every year they go biannually to serve a medical mission in a town called Timo in Haiti. In Haiti, these people have been the victims of, well, since the inception of their country, displacement, poverty, government corruption, health challenges and epidemics that are partially due to the infrastructure and the limited opportunities that the folks there have. And it seemed like the group, the Haitian Health Initiative, has a vested interest in not only going to help people, but remaining in some permanent fashion. The commitment, like I said, is enormous in the sense of we're leaving our practice, we're leaving our family, we're coming up with a lot of money to go and do this ourselves, but more importantly, you're involved in an integral fashion to raise funds, to raise equipment, supplies, and it's not a luxurious trip. We slept basically outside in a shack for 10 days and had no running water and no electricity, and there's a commitment that's involved that kind of helps you to become grounded as a provider, and I think more as a human. So, as I mentioned, the conditions are a little less than perfect. It's not a luxurious trip, but I think inherent to that is more meaning. So when you get to Haiti, there's no infrastructure in Port-au-Prince to control trash. So this is littered everywhere. There's trash. The structures there are very rudimentary, and most of them are broken down or in various states of repair. And in fact, it's one of the poorest and most dangerous places in the Western Hemisphere. So it's not, you don't go there with it unless you have a pretty resound resolve to do what you're doing there. We had the Haitian natives who helped us to transport into the village of Timo, and without that, I don't think we would have been safe, and I don't think we would have made it, honestly. As you arrive in Timo, you have to hike in a good hour with about 50 to 100 pounds on your back up and down these hills, and you start feeling sorry for yourself as you walk down that hill and you're almost to the community center that you have never seen before. And then you get passed by about 4 or 5 Haitian natives carrying twice as much as you are, with big smiles on their face and literally like running up the hill. So it quickly puts things into perspective and makes you realize that you're there to be a part of something bigger than what you may have intended coming in on the plane. So while we were there, the first night we set up a clinic, and the clinic consists of 4 providers, myself included, and then a nursing station. We had a pharmacy there that dispensed medications, again, many of them donated by the clinic. And basically it flows like the fastest urgent care you could ever imagine. Our focus there is in improving health to the greatest amount of people who have the greatest risk. So that's pregnant women and children in these countries. To give you perspective, because of the way that things are arranged, we were able to treat about 1,000 patients within a 5-day period. These people walked sometimes for 2-3 days to get to the clinic for us to offer them what we would consider over-the-counter or minimal treatment, sometimes Tylenol and maybe a toothbrush, and we're showering us with praise and gratitude, and that resilience is something that is innate to all of us, and sometimes we forget where we live. So I think out of all of the things I took away, that was the biggest blessing. Was as a provider, I've been given these opportunities to become educated, to live in a place that's amazing. We have friends that are great mentors and help me out to achieve my dreams here in the States, but in reality, we don't need much to be good people, and we don't need much to be good providers. It takes that humanistic touch, a communication, and a listening ear, and that sometimes I feel like I forget as a provider, and it was just hammered in recurrently throughout that trip. I have to reiterate the importance of my involvement at the Ogden Clinic, because without their support, I couldn't have gone. I couldn't have done anything that I wanted to there. I was able to bring supplies over to the Haitian patients that were pivotal in treating them. And I can't be more thankful for the opportunity, not only to have been given the chance to bring those things to these people, but also the folks that covered for me while I was gone. And what a neat thing to have friends that I work with that are supporting me and doing these things that, again, otherwise I wouldn't have a chance to do. Inherent to that experience in Haiti is the same experience I have or take away at the clinic. The meaning is defining what my purpose is here. We spend so much time at work, and if I did something that didn't make me think about the world as a broader whole or compare my own existence to someone else, I don't think I'd be satisfied as a person, and I'm very lucky because of that.